Today marks 2 weeks since we made that announcement. So that means this weekend that just went by would have been the 2 weeks that we last swabbed those identified cases. So the first thing is the contacts of those cases that were last identified now have gone 2 weeks.
Yeah.
And so we will need to go back and swab them, the ones that were negative, and the ones that were positive as well, or later on in the week. But the ones that were negative to, in point of fact, determine that they still remain negative. So that's the tricky situation, because you will note that most of our cases have been asymptomatic cases. So that's what we would need to go back and do. This weekend would have been the 2 weeks. So this week we start looking out for those that were initially negative to see whether, in point of fact, they are negative. That's one. Two, all healthcare workers that were exposed, I believe most of them have been swabbed. All of them are negative. The ones that are remaining from patient number 10, those are going to be completed this week. Last week, when we were discussing this with the epidemiology team, we were looking at who else do you go and take a sample from? Because we have done that with people who have influenza-like illnesses. We have done it with people who have SARS, which is severe respiratory. We have swabbed all of them. We have swabbed all those healthcare workers that were ill. So one of the considerations we are thinking is doing frontline personnel. I mean, people who are maybe in immigration, maybe tour guides, and do a randomization sampling, because we won't be able to test all. Test people who perhaps have gastrointestinal infections and are showing up in the health system. You know, some patients outside of Belize have shown up with gastrointestinal symptoms, diarrhea, nausea, vomiting, or even people who just fever, do it at random.
Okay.
That's where we want to move this week.